Hey everyone, it's the team from drcini.com here, and in this video, we're going to be talking about something that a lot of my patients ask me about, flying after breast surgery. Whether you've already had implants, are planning on getting them, or have had other types of breast surgery, you might be wondering about the do's and don'ts of air travel. So if you're ready to board that plane with confidence, keep watching. We're going to cover everything you need to know, from how soon you can fly after surgery, to tips for a comfortable journey, and busting some common myths along the way. Let's get started. The short answer is yes, absolutely. Flying with breast implants is completely safe. Now I know this is a common concern I hear from patients, but let me reassure you, airplane cabin pressure will not cause your implants to burst, expand, or deflate. Breast implants are incredibly durable and are designed to withstand changes in altitude and pressure. Think about it, they need to withstand the normal pressures of everyday life, right? These things are tough. So, whether you're jetting off on a short vacation or a long-haul trip, rest assured that your implants are not going to be an issue. Of course, there are some general things to keep in mind after any kind of surgery, which we'll talk about in just a bit. This is a question I get all the time, and it's a really important one. The timing of when you can safely fly after breast surgery, whether it's augmentation, reconstruction, or a revision procedure, really depends on your individual recovery progress and the type of surgery you had. As a general guideline for short-haul flights, those under 4 hours, it's usually safe to fly about 2 to 3 weeks after surgery. This is assuming you're healing well, and you've had your post-op checkups, of course. Now for long-haul flights, those longer than 4 hours, I typically recommend waiting a bit longer, usually 4 to 6 weeks. Again, this can vary, and it's crucial to have that conversation with your surgeon. Remember, I can give you general advice, but I'm not your surgeon. They know your specific case best. Okay, so while the implants themselves are not directly affected by flying, there are a few things you might experience, particularly after recent surgery. One common thing is mild swelling or tightness. This is usually temporary and due to those changes in cabin pressure. It's nothing to be alarmed about, and it typically subsides on its own. Another consideration, especially with long-haul flights, is the slight increase in risk of blood clots, also known as deep vein thrombosis or DVT. This risk is higher after any surgery, not just breast surgery, and there are things you can do to minimize it, which we'll talk about in a bit. Finally, some patients find that sitting for long periods can cause some discomfort, especially if their surgical sites are still healing. Again, we've got tips for that coming up. Alright, let's get into some practical travel tips to make your journey as smooth and comfortable as possible. Before you even pack your bags, schedule a pre-flight checkup with your surgeon. This is just to confirm that you're fit to travel and that everything is healing as it should be. Next, pack any essential medications in your hand luggage. This includes pain relief, any post-op medications your surgeon has given you, and anything else you might need. If you've had recent surgery, make sure to pack extra dressings and wear a supportive, comfortable bra. At the airport, you might be wondering about airport security scanners. Yes, breast implants can be detected, but they won't trigger any alarms. Security staff are very used to this and are trained to handle medical implants professionally. You can also request a private screening if you prefer. Now on the flight, stay hydrated. Drink plenty of water throughout the flight. This helps reduce swelling and improve circulation. Try to move around regularly, especially on those long-haul flights. Stand up, stretch, walk around the cabin every hour or two. And lastly, choose a comfortable seat. An aisle seat is usually a good idea, as it gives you more space to stretch your legs and get up and move around easily. Let's tackle some of those frequently asked questions I get. First up, can my breast implants explode on a plane? The answer is a resounding no. Breast implants are incredibly durable, and cabin pressure changes won't cause them to explode or rupture. Will flying cause pain or swelling in my breasts? If you've recently had surgery, you might experience some mild temporary swelling or tightness, but it should subside on its own. Wearing a supportive bra and staying hydrated can help minimize this. Will my implants show up on airport security scanners? Yes, they might be visible on the scanner, but this is completely normal and nothing to worry about. As I mentioned earlier, security staff are used to seeing this. Can I travel soon after breast surgery? For short flights, usually after 2 to 3 weeks. For long haul, 4 to 6 weeks is generally recommended. But always check with your surgeon. What should I do if I experience pain or swelling after flying? Mild swelling should resolve on its own. But if you experience severe pain, redness, or any unusual changes, it's important to seek medical advice immediately. So, there you have it. I hope this video has put your mind at ease about flying with breast implants. Remember, it's a safe and straightforward process. The key takeaway here is to communicate openly with your surgeon. They are your best resource for any questions or concerns you might have, especially if you're planning to travel after surgery. By taking the right precautions and listening to your body, you can enjoy your trip without any worries.